autonomic nervous system has two parts, sympathetic and parasympathetic. The one which gives sympathy to the person is part of sympathetic nervous system. The one which opposes sympathetic is parasympathetic. If you are asked if you have to lose one of the two components of autonomic nervous system, which one would you prefer to lose? Sympathetic or parasympathetic? I repeat the question. If you are asked, you have to lose one of the two components of autonomic nervous system, which one would you prefer to lose? Sympathetic or parasympathetic? Now depends on whether you want to live or not. Parasympathetic nervous system is anabolic and essential for survival. Sympathetic is required only in case of crisis. So if your life is not having crisis, you don't require sympathetic nervous system. Like the student life, for example. No crisis at all. And having crisis means a real crisis like having your food in the night or air to breathe, water to drink. All these basic necessities are met with. There is no further crisis. You know, students say, no, we have exam. It's a crisis. Exam crisis is like that movie scene. And the villain who is driving a car, and there is a rope tied behind the car, and he is dragging the hero with it. Another hero comes, jumps in front of the car, stops the car, and he goes behind to release his friend who is tied in the back end of the car. And what does he see? And the other hero is not tied at all. He was holding the rope. You are holding the rope. Let it go. Okay. So, student crisis is like that. Exam. You are holding the rope. Let it go. Remember, you should go with the confidence. Things that I don't know are not worth knowing. Okay. And of course, Viva, the greatest fool, can ask more questions than the wisest one can answer. What is the point in doing everything? So we are talking about sympathetic nervous system. Now, the difference between autonomic system and the somatosensory, the spinal, cerebrospinal system. In cerebrospinal system, in the cell body of the neuron, inside the spinal cord, axon comes out and supplies the skeletal muscle. Plain and simple, cell body inside the spinal cord, axons leave from there and supply the skeletal muscle. In autonomic nervous system, there is a difference. Cell body lies inside the spinal cord, or brain cell. Axons come out, but they don't supply anything. They have a synapse with another neuron. And the second neuron goes and supplies the smooth muscles of glands. Then supply the glands directly, supply the smooth muscles around the glands. Like myoepithelial cell or something. They don't supply the gland. They supply the muscles surrounding the gland, smooth muscles surrounding the gland. So since it's a two-order neuron, the first neuron, anatomists call it as preganglionic. The second neuron is called as postganglion. Before the ganglion, axon before the ganglion, axon after the ganglion. Ganglia is a collection of cell body outside skin. Physiologists give it a better name. They call the preganglionic as connector neuron and the postganglionic as effector neuron, because the effects are produced by the postganglion. So connector neuron and effector neuron. So there are some principles, and this connector and effector are present in sympathetic and parasympathetic both. What is the big similarity? All connector neurons, without exceptions, are violated and therefore appear white. All effector neurons, without exception, are unminded. So they are grey in color. And transmission of impulses is slow. That's a similarity between sympathetic and parasympathetic. How the difference? The preganglionic and sympathetic are short. Postganglionic is long. And the preganglionic is sympathetic. Parasympathetic. Preganglionic is extremely long. And the postganglionic are excruciatingly small. Except in the head region, where we had seen 4 ganglia, all of which were parasympathetic ganglia, where the ganglia are close to the target organ, but a little away from it. Like for example, ciliary ganglia was lying in the orbit. I had to supply 2 muscles inside the eyeball. The pterygomerular ganglion lies in a strategic position from where it is close to heart, palate, pharynx, nasal cavity, and lacrimal gland. 4 target organs supplied. Parotid, the ganglion from parotid to otic, lying next to the ear. The gland is also next to the ear. Submandibular ganglion is in relation to submandibular gland. So the postganglion are not very long, but at least it was a little away from the organ that is supplied. From neck onwards, postganglionic parasympathetic, the length is 0 centimeters. Because the preganglion terminates in the wall of the organ that it wants to supply. That was long. So the ganglia lies in the wall of the organ, obviously from there it can directly supply the organ that it wants to supply. This is parasympathetic. Now sympathetic, the preganglionic are short. They start from the spinal cord and terminate in the sympathetic chain and like paravertebrate. Sometimes they don't synapse in the chain. They synapse in the ganglia in relation to the lumbar vertebrae. So paravertebral chain for relay of ganglia or prevertebral for relay of some ganglia. We'll see the difference that when they synapse where, for what reason. Before that, the highest center, the boss of autonomic nervous system for long was recognized as hypothalamus. Because the anterior part of hypothalamus, also called rostral hypothalamus, is concerned with centers for parasympathetic nervous system. And the posterior part of hypothalamus, also called caudal hypothalamus, has got centers for sympathetic nervous system. So caudal for sympathetic, rostral for parasympathetic. It was found that these are not really the highest center. Controlling the hypothalamus indirectly is controlled by limbic lobe of the brain. So limbic lobe of the brain has got centers for emotion receive memory and autonomic. So it's the limbic lobe which controls the hypothalamus, which directly controls the autonomic nervous system. So when you are excited, the heart rate rises, pupils dilate. So the limbic lobe decides the emotion and sends the information to hypothalamus, which causes the concerned activity. Dilated pupil is considered the beauty sign. It means the other one is as much interested in you as you are in him, her or it. Rise in heart rate is a sign of excitement. That's also sympathetic nervous system. Then we change the boss of autonomics from hypothalamus to limbic lobe. So now we know further that the limbic lobe is controlled by prefrontal cortex, the boss of the boss. So prefrontal cortex is concerned with all activities, somatic, visceral, thinking, thought, personality, and everything. That's why, even if you are depressed, if you want to show that you are not depressed, it's prefrontal. That's why in this song, तुम इतना क्यों मुस्कुरा रहे हो, क्या गम है जिसको छुपा. We are showing a smiling nature as prefrontal cortex. Limbic lobe cannot change the mood. Whatever is the mood that will be expressed. The prefrontal cortex. And sometimes you hear a shocking news. Prefrontal cortex processes it, and you have a skipped heartbeat because of the shock. Skipped heartbeat is autonomic. Autonomic is controlled by hypothalamus. It doesn't know what is the news. Limbic lobe doesn't know what is the news. Prefrontal lobe. Prefrontal controls the limbic controls the hypothalamus, skipped beat. Okay? Our focus is not higher center. Our focus is lower center. Thoracic lumbar outflow is a sympathetic outflow. T1 to L2. And these 14 spinal segments, T1 to L2, has to supply everything from scalp to soul. Unlike parasympathetic, which supplies only internal organs, sympathetic has to supply everything from scalp to soul, because sympathetic nervous system supplies the skin, the sweat glands of the skin, the erectile bile muscle of the skin. Wherever there are blood vessels, sympathetic is bound to form. Thyroid gland, let's take an example, is an endocrine gland which is controlled by other endocrine glands. Thyroid need not have a nerve supply. And right, it does not have a nerve supply. But the blood vessels which come to the thyroid gland, and blood vessels has got sympathetic nervous system. It's not meant to supply the gland, it's meant to supply the blood vessels which is supplied. Right. The preganglionic fiber which are emerging from T1 to L2, as you said, preganglionic are white. They come out of the spinal cord along with the motor nerve root. So if you remember Bell-Magendie law, the anterior root is motor, the posterior root is sensory. The preganglionic fibers accompany the motor root. In contrast to vagus nerve and facial nerve. Facial nerve is the motor root and the sensory root. That's a root called as nervous immunities. Parasympathetic fibers of facial accompany nervous immunities. It's a motor root and a parasympathosensory root. Similarly, vagus itself is parasympathosensory. Cranial accessory is its motor. The 10th cranial nerve should be correctly called as vagoaccessory complex. Because parasympathosensory root is vagus, the vacuomotor fibers are cranial accessory. So, in parasympathetic outflow of the cranial cavity accompanies the sensory root, whereas the sympathetic activity of thoracolumbar and the parasympathetic activity of the sacrum accompanies the motor. It comes out of the motor root, which is divided into ventral ramus and a dorsal ramus. The sympathetic accompanies the ventral ramus for a short distance, and then it leaves the ventral ramus to join the sympathetic chain. Leaves the ventral ramus to join the sympathetic chain. Why is the chain and not a ganglia? Few fibers of the preganglionic fiber terminate in the ganglia. Few fibers rise up from their position where they started. Few fibers descend down from where they started. Few fibers rise up, few fibers descend down. That's why the ganglion is connected to each other by a chain. And the chain is also white in color because they are all preganglionic fiber. So some preganglionic fiber terminate in that ganglia. Some ascend upward, some descend downward. How do you know which ascends up and which descends down? Those which are of the upper thoracic segment, they will ascend upwards. Because cervical part, there is no outflow for sympathetic. For head and neck region, there is no outflow for sympathetic. In the thoracic segment, you have to ascend up to supply head and neck. Lower thoracic and upper to lumbar, they have to descend down because there is no sympathetic outflow for L3, L4, L5, S1 to S5 oxygen. As you said, sympathetic has to supply everything to scan to the soul. Automatically, all throughout the head to foot, sympathetic has to reach the sympathetic system. Starts from base skull and goes all the way to oxygen body. That's why, because some fibers ascend up, some fibers descend down, all the ganglia are connected to each other by a chain. From the ganglia, postganglionic fibers emerge, which joins the spinal nerve again. Join the spinal nerve again. And through the spinal nerve, it reaches all parts of the skin. The postganglionic fiber emerges from the sympathetic chain, joins the spinal nerve again, and along with the spinal nerve, both ventral nerves and dorsal nerves, it supplies all the blood vessels, all the skin, all the somatic region. What it does not supply, it does not supply skeletal muscles, but it supplies the blood vessels of the skeletal muscle. It is the skeletal muscle himself. The branch of the ganglion rejoining the spinal nerve is grey in color, so it's called as grey rebus communicans. From the spinal nerve, so coming towards the ganglion, or spring ganglion, so it was called as white rebus communicans. Communicans is singular, communicantis is plural. So white revi communicantis or white rebus communicans. The most ganglion fiber are grey rebus communicans. But this is a part of sympathetic nervous system concerned with somatic system, supplying the body wall, skin, blood vessels. Besides that, the chain will also give a branch called visceral branch, which will supply the organs. In the neck region, they supply organs, they also supply blood vessels. However, you said sympathetic nervous system starts from base skull. If it starts from base skull, how will it reach the skull? It's at the top of the skull. And there are no spinal nerves to supply the skull. So for that, there are branches from the base skull which travel with internal carotid and external carotid artery, called as internal carotid nerve and external carotid nerve. And wherever these vessels supply in the head region, yes, sympathetic plexus travels with them. The sympathetic plexus are nervi vasorum, the nerve of the artery. And from that nervi vasorum, it goes as supply. All parts which are external carotid or internal carotid will supply. And with the whole head. Then sympathetic chain from the neck and thorax, they will supply the heart through cardiac plexus. They will supply the lung through pulmonary plexus. You will say, fine, you can understand that thoracic visceral branch should supply heart and lung. Why does cervical part supply the heart? Why does vagus nerve cervical branch give cardiac branches? Anyway, vagus is very beautiful. Why should it give the branch here? Because heart development was in the neck region, just below the stomatolia. In the neck. Then it is descended down into the thorax. So when it was in the neck region, it got branches from sympathetic chain and vagus nerve. And it descended down into the thorax, carrying the nerve with it. Additional branches join it from the thorax. All these branches, which is supply the heart and the lung, are those ganglionic. They are already related in the chain. Thoracic chain also supplies abdominal organs. Thoracic part of the sympathetic chain also supplies abdominal organs. This is shocking. The chain is there in the lumbar region. But thoracic segment supplies the abdominal organs. Here lies the difference. The three nerves which are going to the abdomen from the thoracic part of sympathetic chain, supplying viscera of the abdomen, are called as greater splanchnic nerve, lesser splanchnic nerve, and least splanchnic nerve. Greater splanchnic nerve, lesser sphincteric nerve and least sphincteric nerve. Greater sphincteric nerve arises from T5 to T9 ganglia of the sympathetic chain. T5 to T9. Lesser sphincteric nerve arises from T10 and T11 ganglia, and the least sphincteric nerve arises from T12 ganglia. The thoracic part of the sympathetic chain, ganglia which are there, greater, lesser and least sphincteric nerve are preganglionic fibers. Greater, lesser and least sphincteric nerve are preganglionic fibers, that is white in color and observable in dissection. The descent into the abdomen, the relay has to take place. The relay will take place around the celiac artery and superior artery. So they are called celiac ganglion and superior ganglion. These are the sympathetic ganglia which has failed to relay the thoracic area, come to the abdomen and relay the preganglionic area. These ganglia, celiac ganglia and superior ganglia, lie in front of the abdominal aorta. So they are called as prevertebral ganglia. The sympathetic chain was called as the paravertebral ganglia. Those which are in relation to abdominal aorta are prevertebral. Question would arise, why did these fibers not relate the thoracic region in the paravertebral ganglia? Whenever a sympathetic nerve wants to change the region from thorax to abdomen or abdomen to pelvis, they will travel as preganglionic itself. Whenever it wants to supply organs in the same body cavity, it will go ganglion. So, ganglion relaxation, paravertebral relaxation will occur for visceral branches supplying the same body cavity. It is thoracic to thoracic, lumbar to lumbar, sacral to pelvic organ. They are all those ganglia. Whereas thoracic ganglia supply abdominal cavity, it will be preganglionic. Abdominal ganglia supply pelvic cavity, will be preganglionic. Abdominal ganglia supply abdominal organ, postganglionic. That's the general principle which is there. Why is this so? This is so that the postganglionic fibers, which you said, are non-vibrated. They travel a long distance, but you don't want to change the region. If they change the region, chances are they can get damaged. They are after all non-vibrated. So, when they are changing body cavity, the preganglion itself travels. So greater, lesser and least sphincteric are visceral branches of thoracic ganglia supplying abdominal organ. From the lumbar part of the sympathetic chain, those who supply lumbar organ are postganglionic. They are related in the paravertebral chain. Those branches from lumbar ganglia supply pelvic organ are preganglionic. They go down to the pelvis and relay on either sides of the rectum, but in front of sacral vertebrae. So paravertebral have become prevertebral in the pelvis. second part of the sympathetic chain also supply various organs. So there will be both ganglion. Because ganglion supply its own region. The relay will occur in the parietal region. Ganglion supply another region which can pass without relay to relay in the prevertebral. Coming back to summarize the autonomic sympathetic part, sympathetic nervous system, altogether, there are paravertebral sympathetic chain which receive feeders from the T1 to L2 spinal nerves. These preganglionic fibers, also called corrector neuron, are myelinated, accompany the motor root, ventral spinal nerve, and join the chain. And that between the ventral ramus and chain is called right ramus community. Majority of the fibers relay in the paravertebral chain, either at same segment, upper segment or lower segment. From this chain gives visceral branches which are post-ganglionic to supply the same region. Few fibers also join the spinal nerve back. Those which join the spinal nerve back are gray ramus convoluta, and the other gray ramus is the visceral branch supplying the same organ, thoracic organ. Those which are supplying the abdominal organ, greater, lesser, and least spinal, they will pass through the diaphragm to reach the abdominal aorta, in front of the abdominal aorta, where the celiac artery and superior artery are given. They will relay the celiac and superior ganglion. They are called the prevertebral relay. Accompanying the celiac artery and superior artery, it will supply foregut and midgut. Then, incidentally, greater sphincter supplies foregut, lesser sphincter supplies midgut, least sphincter supplies kidney. Then there is a lumbar part of sympathetic chain and a sacral part of sympathetic chain. Lumbar part of sympathetic chain supply hindgut organs of abdomen are post-ganglionic. There is lumbar part of sympathetic chain which supplies pelvic organs are preganglionic. So they are changing region. They will relay in front of the sacral vertebrae or either side of the midline rectum. Prevertebral relay, that is where the vertebra. Second part of the sympathetic chain, all are post-ganglionic because they supply the pelvic organ. Neurotransmitters. Wherever there is a junction between two neurons and neurons and smooth muscles, some chemical is released, and that's called neurotransmitter. At the connector end, the neurotransmitter release is acetylcholine, no exceptions. The connector ends in the ganglia. The neurotransmitter release is acetylcholine, no exceptions. At the effector end of parasympathetic nervous system, the liberation is acetylcholine again, no exceptions. So So preganglionic end acetylcholine, postganglionic end of parasympathetic nervous system is acetylcholine. What is the difference between the acetylcholine liberated at preganglionic end and postganglionic parasympathetic end? Acetylcholine is no different, but the receptors are different. At the ganglionic end, the receptors are nicotinic. Because nicotine in cigarette smoke, they stimulate those preganglionic ends. Nicotinic receptors are also seen at neurovascular junction. Here I am talking about skeletal muscle. There also is thermodynamic limited, there also is nicotinic receptor. Whereas postganglionic parasympathetic endings at the smooth muscle are acetylcholine with muscarinic receptors. Muscarinic receptors. In people who try to poison themselves by drinking insecticide, they are called as OPC poisoning, organophosphorus compound poisoning, OPC. What happens is the OPC and acetylcholine mimic each other. OPC and acetylcholine mimic each other, and therefore nicotinic receptor and muscarinic receptors don't get overstimulated. And those which are overstimulating the heart region, parasympathetic nervous system will stop the heart. And the person dies because of cardiac failure. So if you manage to save the patient before he dies, you have to give a muscarinic blocker. If you give a muscarinic blocker, the effect of postganglionic parasympathetic fiber, our heart will stop. That's very important. So people don't bother at NM junction what happens. People don't bother what happens with the preganglionic end. Nicotinic receptor is not important. Muscarinic receptor can kill. So you give a muscarinic blocker. They are effective muscarinic blocker if you manage to save the person before they actually die. For the sympathetic nervous system also, the preganglionic end is acetylcholine. The postganglionic end differs. At those places, the neurotransmitter liberated is noradrenaline. At select places is acetylcholine again. I was trying to think about if most of the places sympathetic effector ending is noradrenaline, why is it that in some places they liberate acetylcholine? Some places. And what about some places? The some places have the ordinary sweat glands and certain blood vessels of skeletal muscles. The acetylcholine liberated at the sympathetic nerve ending at ordinary sweat gland and select blood vessels of skeletal muscles. So I was trying to think about why is it that it is mimicking parasympathetic. Then I realized it is actually doing parasympathetic job. Remember, sympathetic job is to shiver and raise the body temperature. Parasympathetic job is to call a fall in body temperature. Sympathetic job is to shiver and you do the rise in body temperature. Parasympathetic job is to lower the body temperature. The fastest way of lowering body temperature is sweating. Sweating causes evaporation causes cooling. So, but parasympathetic does not release sweat gland. Only sympathetic releases sweat. So sympathetic releases the sweat gland and does the job of sweating, evaporation, cooling. Actually the job of parasympathetic. So that's why it liberates also like parasympathetic as a sympathetic. I said ordinary sweat gland. There are certain specialized sweat glands, like in the forehead, palm, sole. These are areas where the sweat glands are supplied by organ. There is what is called as cold sweat. If you feeling cold, you are sitting in the reception room in the lecture hall, awaiting your next turn for Viva. Air conditioned room and you are still sweating. That's cold sweat. Similarly, when you are playing badminton, sometimes cricket also, the bat slips out of your hand. Why? Because the palm and all sweating. So the specialized sweat glands are supplied by skin and urine. These are examples of cold sweat glands. So what about skeletal muscle? What about the blood vessels of skeleton? Ordinarily the rule states that sympathetics cause vasoconstriction. Sympathetics cause vasoconstriction. That's why when it comes to salivary gland, parasympathetic are secretomotor, but they secrete watery secretion. Sympathetics are vasomotor, so they cause vasoconstriction and to produce the mucus secretion. So mucus secretion, viscous secretion, vasoconstriction is sympathetic secretion. Whereas enzymatic secretion, the watery secretion, is your parasympathetic. The sweat glands are called serous acini and mucous acini. Serous acini are controlled by parasympathetic. Mucous acini are controlled by sympathetic. So they usually cause vasoconstriction. But when it comes to sympathy, suppose there is a tiger in front of you. What do? You move to the next cage. I believe the tiger is inside the cage. Otherwise you don't have to do anything. Tiger will do everything. Let's forget tiger. Let's take a more realistic example. There's a dog in front of you. Unknown dog and he is gnarling. What do? You got two options. Run away. Flight. And flight can cause you to fly. If you are cornered, there is no option, then you fly. Sometimes you do neither and you freeze. So all those F's are sympathetic nervous system. First is the flight, and flight can cause you to flight, flight can cause you to fight, the flight can cause you to freeze. But when you want to flight or fight, when you want to run away, your lower limb must get extra blood supply. You can't afford vasoconstriction. You want vasodilatation. Similarly, when you are fighting, your upper limb skeletal muscle require extra blood supply. So those select blood vessels supply the skeletal muscles. those upper level, lower levels have got a few acetylcholine neuroleptics. Normally they are neuroleptic. But few of the blood vessels, or few of the muscles of upper limb, and few of the muscles of lower limb are supplied by acetylcholine neuroleptics, which is considered vasodilation. To increase the blood flow to those muscles which are required at that time. Sometimes neither of the vessels open up, you can either run away not by, and you can other end freeze or shock. Anyway, these are threats. Examination is never a threat. Okay? How many examples of unipolar neurons do you know? Unipolar? Okay? All the dorsal nerve ganglia are unipolar, formerly called as pseudo-unipolar. There is no such thing as pseudo-unipolar in modern terminology. So all the dorsal nerve ganglia and all the sensory ganglia of cranial nerves, all the sensory ganglia of cranial nerves are also unipolar. Dorsal nerve ganglia is also sensory. In other words, you can say sensory ganglia of cranial and spinal nerve are unipolar. With three exceptions. Cranial nerve number 1, cranial nerve number 2, and cranial nerve number 8. The first neuron which is there is bipolar and not unipolar. Bipolar. Clearly two neurons, the axon and nucleus, arising from opposite and 1, 2 and 8. Otherwise, the rest of the sensory ganglia are unipolar. How many multipolar neurons you know? All others are multipolar. Everything else is multipolar. So, unipolar are the sensory ganglia, bipolar are first neuron of first nerve, second nerve, and rest all are multipolar. How many apolar neurons you know? No axon, no dendrites. They are present in fetal life. Before the process starts, all neurons are apolar. Are they present in adult life? When the neuron recover then, two neurons recover. Neuron is described as post-mitotic. If a neuron is dead, it is dead forever. It will not recover. And there are certain apolar neurons present in suprarenal medulla. Suprarenal medulla contains neurons which have no axon, no dendrites. They are cell bodies themselves, without axon dendrites. So, the preganglionic fibers terminate on the suprarenal medulla. Suprarenal medulla itself is the postganglionic fiber, postganglionic cell, without any process. So, they release the neurotransmitter directly into the blood vessel in the suprarenal medulla, in the vein of suprarenal medulla. This neurotransmitter liberated and suprarenal medullary blood vessel is 90% adrenaline and 10% noradrenaline. So suprarenal medulla liberates 90% adrenaline, 10% noradrenaline. And this adrenaline will travel through bloodstream and act on different organs of the body simultaneously. That's why Sympathetic is usually a generalized action. Your brain becomes alert, your pupils dilate, your face becomes pale, your heart rate rises, your respiratory rate rises, blood vessels to skeletal muscles dilate, blood vessels to GI tract constrict, skin constrict, you shiver, everything all sympathetic activity happens together. Parasympathetic activity is more localized action. Not just this, there is one more difference. One preganglionic parasympathetic fiber activates one postganglionic parasympathetic fiber. In contrast, one preganglionic sympathetic fiber stimulates 10 postganglionic sympathetic. So where it was 1:1 at parasympathetic level, and that's why localized action. Here it's 1:10, more generalized action. Plus adrenal medulla, liberating a hormone which will act throughout the body. But remember, sympathetic is a catabolic system. Tiding over immediate crisis. Parasympathetic is anabolic. So digestion, absorption is all job of parasympathetic. Think of those who give you stress and effect that happens to the body. It's all sympathetic. When you see that dog in front of you, and people will dilate. Have you really seen the dog? That comes to the conclusion of this presentation. The thorax, abdominal, sacral sympathetic chain are similar. The cervical chain is slightly different in the sense that first, there are only 3 ganglia in the neck, not 8. It should have been 8 because 8 spine, no? You can say they were 8, but they got fused. Upper floor got fused together. So that's why there was communication for the superior cervical ganglia joint C1, C2, C3, C4. The middle one joint C5, C6. The lower one joins C7, C8. Sometimes it also joins the T1. If it joins the T1, C7, C8, it is called as ciliary. The other difference in the neck region is it gives somatic branches, which we said grade A was coming there. It gives visceral branches accompanying internal and external carotid artery. It also gives vascular branches. Besides internal and external carotid artery, it gives branches to the inferior thyroid artery. It gives branches to the subclavian artery. So, superior ganglion gives branches to internal and external carotid artery. Middle one gives to the inferior thyroid artery. And lower one gives branches to the subclavian artery. So there are somatic branches, there are visceral branches, and there are vascular branches. You will say, but we just said greater strength in the accompanying celiac artery. The accompanying celiac artery to supply the target organ. When you say vascular branches, the target organ is the blood vessel. Okay? So cervical part of the sympathetic chain, the target organ is not only the viscera that the blood vessel will supply, but the blood vessels themselves. Whereas in the upper region, second region, wherever there are plurivertebral ganglion, they are accompanying the blood vessel to reach the target site. And supply the target organ, not the blood vessel themselves. Okay? Can you stop there? It is 12:25 in this box. Compared to the postcard, it is at 1:25 in this box.
Sir,